To effectively oxygenate a patient using bag valve mask ventilation, you need an adequate sized bag with an oxygen reservoir and a good seal around the nose and mouth. This will allow the movement of high concentration oxygen to the patient's lungs with each compression of the bag. The best way to know if oxygen is being transmitted to the lungs is to look for the rise of the patient's chest each time the bag is squeezed. Chest rise can sometimes be harder to visualize from above. If you're not sure if the chest is rising with each compression of the bag, you can ask a colleague to look at the patient's chest from the side, where the movement can be more easily seen. People often ask how much should the chest rise by during bag valve mask ventilation. The answer is just enough. You don't want to damage the lungs by overinflating them. Squeeze the bag slowly over about 1 second with just enough pressure to make the chest rise. Then allow a pause for the chest to fall before squeezing the bag again. If the chest is not rising when you compress the bag, there are several things that may be going wrong. The most common reasons for not getting good chest rise with bag valve mask are firstly an incorrect positioning of the head, use of a bag that is too small, or a wrong-sized mask for the patient, and lastly, failure to create a seal around the mask. If there is no rise of the chest, the most likely reason is incorrect positioning of the head. Try repositioning the head to see if this will open the airway. Another common error is to use a bag that is too small for the size of the patient. Self-inflating bags usually come in 3 sizes: 250 ml for newborn or premature babies, 500 ml for infants or children, and 1,500 ml for adult patients. Do not always reach for the smallest bag for pediatric resuscitations, as it may be too small to move the child's chest and ventilate them. Masks for bag valve mask ventilation come in a variety of shapes and sizes. The right size of mask is one that covers the nose and mouth of the patient, but ideally does not cover the eyes or overlap past the chin. It is possible to ventilate a child with a mask that is too big, but much more difficult to do so with a mask that is too small. If you only have a mask that is too big and it is a life or death situation, you will need to overlap the eye area and try your best to create a seal. In order to ventilate a patient using a bag valve mask ventilation system, you must have a tight seal around the mask. This means that air should not leak from around the mask when you squeeze the bag. To create a good seal, press down on the mask from above with your thumb and index finger in a C shape. At the same time, lift up the jaw into the mask using your little finger, ring and middle fingers in the E grip. If you do not have a good seal around the mask, you will hear air escaping around the mask when you squeeze the bag. If there is a good seal around the mask, you will not hear escape of air when you squeeze the bag, and you will see good chest rise happening each time the bag is compressed.